Falls prevention. 5 things for practitioners to think about. It may not be in your job title, but if you have a professional or voluntary role working with older people and are in a position to give advice on how they can reduce their risk of falls, then you are a falls prevention practitioner. Whether you're a health professional, community care worker, fire officer or exercise trainer, your support and advice is vital, and this video is designed to help you. In a situation where more than a third of people over the age of 65 have a fall which requires hospital treatment every year, your role in protecting families and loved ones is more important than ever. Anything that can be done to reduce the risk of falling will help people to live safe, active, independent lives for as long as possible. We're going to take a look at the factors that increase a person's risk of falling in later life and the simple actions you can talk to them about to reduce the risks. 1. Sit less, move more. Exercise is good for our all-round physical and mental health, and strength and balance exercises in particular have been shown to reduce the risk of falls. Encourage people who are becoming less active to find out more about simple exercises they can safely do in their own home, and point them to local services that provide support. Remember, it's important that people are doing evidence-based activities that meet their needs, and encourage them to do the exercises daily. 2. Take a fresh look at the home. It's the most familiar place, but it's also where most falls happen. Are there simple changes that can be made to make the home environment as safe as possible? Maybe you can help people work through a checklist and provide a fresh pair of eyes. Removing trip hazards and replacing worn slippers is a great place to start. 3. Consider sight. As eyesight deteriorates, reduced vision can contribute to a greater likelihood of falls. If you are aware that a person is struggling with their eyesight, remind them to check if they're entitled to a free eye test. 4. Think medicine. Did you know that people taking 4 or more medicines are at an increased risk of falls? People should never stop taking medication without their GP or hospital consultant's advice, but it may be worth encouraging them to get a medication review to ensure it is still right for them. 5. Plan to get up. The consequences for someone who's fallen can be much worse if they are unable to get up or have to wait a long time for help. Encourage people to learn simple techniques that can be used to help get themselves up safely should a fall happen. These are just 5 ways in which you can help the people you provide services for become more aware of what they can do to keep themselves safe.